Hi, this is Dr. Craig Lowe. We're going to be doing a video education movie on plantar fasciitis. Plantar fasciitis is the most frequent ailment seen by podiatrists and foot specialists and surgeons. The plantar fascia is a thick band of tissue that runs from the heel and inserts into the bottom of the foot in the arch area. The cause of plantar fasciitis and associated syndromes such as heel spur and calcaneal bursitis, or inflammation of the heel, is mechanical. Basically, the foot cannot absorb this cyclic load efficiently, and as a result of repetitive shock loads into this area of the foot, inflammation sets up and pain sets up, and the pain can be very severe, affecting other joints of the body, including the knees, the hip, and the spinal architecture. There is basically a failure of the joints of the foot to properly lock during the mid-stance phase of the walking or gait cycle. The mid-stance phase of the gait cycle is the second phase of ambulation after heel contact, when the entire foot has contact with the ground. That is the mid-stance phase of walking. And this condition is usually lengthened in the gait cycle, leading to abnormal motion of the joints of the midfoot called pronation. This excess motion results in the arch of the foot collapsing. And what happens is that the joints don't support weight like they should. They give way, the joints collapse, and the force of body weight goes onto the plantar fascia. And this repetitive shock loading creates an inflammatory cycle that sets up. Now, the only way that this mechanical problem can be fixed is through the use of a biomechanical device called a bioengineered device. There are basically four kinds of foot supports. There's prefab, which assumes all of our feet are the same, that we all come off an assembly line. There's accommodative, which really just offloads pressure in a particular area of the foot. And then there's orthotics, which are made by casts and foam boxes, which have air involved in them. And then the highest level is bioengineered, which is made from 3D kinematic imaging systems or computers that provide a tremendous amount of information to both the doctor and to the technician about how the foot is operating. It is important that we get a lot of information relative to the stance loading of the foot when the foot is not in motion, and in the motion side of the foot we call dynamic gait. Dynamic gait is the phase of the walking cycle where we're in movement, where we're moving forward. We have mass and acceleration and motion control to take under consideration. This bioengineered orthotic is essentially made from these 3D computer studies. Balance, pressure load, motion analysis is performed and analyzed. Medical technicians get to see an enormous amount of information that can maximize the mechanical manufacturing of the custom orthotic for the patient.